On April 17, 2020, Dr. Stefano Manera gave an interview to a small Italian television network. Dr. Stefano Manera is a specialist in anesthetist and also in cardiopulmonary resuscitation. He works at Giovanni XXIII Hospital in Bergamo, Italy. Before we start, I have to say that this interview was made in Italian, and the goal of this presentation is to translate in English what the doctor is saying. Why this interview is important is because, as you maybe know, Italy at the present time, on 22 of April of 2020, is the country number 1 on the world for diseases related to coronavirus, with 25,000 diseases already. And the concentration of these diseases is mainly on the region of Lombardy. That is a region in Italy, in the north of Italy, where the main town is Milano. And the main focus of this pandemic is the city of Bergamo. Of these 25,000 diseases, only this region, Lombardy, has more than the 50%. And the Bergamo hospital was for many weeks and still at the center of this big storm. Dr. Stefano worked at this hospital in Bergamo, that is the biggest hospital of the town, and therefore there is no place on the whole planet with more experience about this coronavirus than the one that these doctors and this team has in these days. Then this is why I believe it's important to hear what the doctor is saying, also because he is giving a different approach about this problem. And these are the notes that I take for the translation. The point number 1, the doctor starts saying that basically at the beginning what it was missed was the fact that the patient were completely alone at their homes with not the presence of nobody, and for maybe 10 days they have a fever and all the symptoms, and things start to complicate it. And when things were already complicated, they were bring to a hospital in a situation that will require already intensive care. Therefore, what's happening is that the hospital that has a limit amount of intensive care places has less places than patient, and therefore it was very bad at that moment. Number 2, that the doctors that work directly at the home with the patients were missed, basically. Number 3, that at the beginning everybody was thinking that this was like an influence. Then they understand that were like a pneumonia, that unfortunately China didn't send the information that was needed at that time. Nobody knows what it was, the nature of this disease, and everybody, as a consequence of this, was completely unprepared for this emergency. Number 4, that unfortunately many doctors died due to this situation, due to the lack of preparation and also equipment. Is over 100 now in Italy, really a lot of doctors that die. Number 5, that lockdown is good until, let's say, a certain point, but an extended lockdown may deteriorate people and decrease the defenses of the people, and this may create more problems. Number 6, that this pathology, and this is the main thing about what he's saying, is not only about the lungs, but it includes all the organs. And the reason is because this virus attack not the lungs directly, but what attacks is the blood vessels. And this change everything, because the doctor is saying that at this point we may deal with this virus before the arrival to the hospital at the people homes. Number 7, that this disease is divided in 3 phases. The phase number 1 is the viral phase, that is similar to an influenza, and but that action is needed as soon as possible, even from this phase. Number 2, when you have the pulmonary phase, where the patient is not able to breathe so easy, and this is more short. The first one is like 10 days, the second one is less time. And then you go into hyperinflammation, that is the most dangerous, and that will require to have intensive care, and is where you may have like a cytokine storm or things like that that are very risky for your life. The doctors say that if you are able to have an intervention in the first and second phase, then many things may be avoided. Then for the first and second phases, he is recommending basically 3 types of drugs. Number 1 is antiviral drugs. Number 2 is the chloroquine that has been discussed a lot. That is anti-malarial and anti-inflammatory and anti-rheumatic drug. And then the last one is a low molecular content of heparin. Now, before we go to that, I want to show this small graphic where basically what the doctor is saying is that COVID-19 is not attacking directly the lungs, but is attacking all the organs through an inflammation of the blood vessels. Okay? And after that, what's happened is that you may have pneumonia or thrombosis. Okay? Then what he's saying is basically that we need to work in this area before we arrive to this area to avoid that many patients arrive here, and to take care of people on this stage. Then we say that chloroquine is basically the first one, the antiviral drug, will make life, and I don't use in medical terms, but it's what I understand, make life of the virus more difficult. The chloroquine, hydroxychloroquine, then he spoke about a specific one that is named Plaquenil, is anti-inflammatory and anti-rheumatic, but basically what it is needed in this situation is to try to control the inflammation, to decrease the inflammation. And then we have the low molecular content heparin that basically will help for a protection of the blood vessels and to avoid a thrombosis, and to help to modulate the answer of the immunitary system, because what happen when we are in second and third phase is that you may have a cytokine storm. Basically, when cytokine storm is when you have immunitary reaction that is potentially very dangerous because it's very aggressive, and instead of protecting from the virus, it will attack all the organs. And this what we say about this low molecular content of heparin will have to modulate this answer of the immunitary system. Okay. Then the doctor said that number 8, that all the patients that arrive with a high inflammatory pre-existent conditions are in danger, because if you already have inflammation and this virus what creates is more inflammation, is like you are already in half of the road of a bad situation. Why are the reasons of the inflammation in the world of today? There are many, but basically overweight is one, to be hypertensive is another, to have mellitus diabetes, to have a bad diet, to have an abuse on drugs, an abuse on alcohol. All these things create inflammation, and if a patient have inflammation, then it is potentially dangerous. Or another thing that he's saying is the intestinal flora is important to maintain in good condition in order to be protected, and also to have a good quantity of vitamin C and D and zinc and selenium, that are things that will help on this condition. Okay, then the doctor spoke about the vaccine, and basically he's saying that experts on coronavirus we don't have, because this is only 2-3 months old problem, and it's very new. We don't know if this type of coronavirus will give immunity or no. We still don't have an answer about that. It's a virus that change very fast. Then it's difficult to find an immunity to a virus that is changing continuously. And these are the reasons why this, in his opinion, is not so easy to find this vaccine. Now, people that was making the interview asked the doctor about what he's thinking about many subjects around the world, pharmaceutical companies, universities are trying to do. That is basically to make that the period of study of the new vaccine become more short. And the doctor believed that to do this very fast may be an imprudence, because he's saying that in order to have a vaccine that give all the warranties, you need maybe almost 2 years, maybe less, but it takes time, because he say you need preparation on the glass, you need to try on the glass, you need to try with animals, and you need to try with people. And if you jump over these steps, what you may have is a vaccine that is not safe, that you may have a vaccine that may create other diseases, and also a vaccine that you don't know, you are not completely sure, that will create an immunitary memory. Then he's saying, and this is important, number 10, that considering the fact that now we have the possibility to use drugs in a preliminary phase, and drugs that are already approved, are ready, and are cheap, okay? and to have a strong reduction on the symptomatology, the symptom reduction that will help in the final cure of the patients, then he believes that not that we don't need the vaccine may continue the research and all that, and at a certain point, but for the moment we need to concentrate more strength on these phases, the preliminary phases, in order to avoid to arrive until the end of this cycle in a bad situation, and in order that the people to arrive to the bad situation is few people, not a lot of people. The first thing, 11, the first thing for a vaccine is not to create more damage. Number 12, they ask him about what he think about the fact that there is a lot of pressure, also commercial pressure, to produce a vaccine. And he said that the vaccine is important for the future, but that is important also that the fact that we focus only on the vaccine will not put on hide, on in aside, the possibility to fix the situation, to start to fix the situation from now with the elements that we have from now, that will remove a lot of pressure from this emergency. And maybe on the future, maybe it will be the right road. Maybe at the end of the day, we will not need to have a vaccine to fix the problem, but we will learn how to deal with the problem. He also spoke on point number 13 about prevention, and he said that prevention in Italy and all the Western world has been completely abandoned. Nobody is interested on prevention. Is a second order problem. But in this case, in this emergency, is also important prevention, because as we said, if the problem is that the virus will create this inflammation on the blood and the blood vessels, and people, for the reasons that I already mentioned, has already inflammation, is already on that condition, then the road to finish in a bad place is more short than if you are in a good health, and therefore you have a more long road to avoid to a bad place. Okay. Another thing that the doctor said, point number 14, is that prevention is not to make a lot of early diagnosis, but to make that people don't become sick, and you arrive to this only giving to people training, information, and about what is healthy, how to live a healthy life, and in order that when something like this arrive, like this coronavirus, the population is in good shape and is more difficult, that will become sick and also dead due to this. Number 15, that the doctors need to go out of the hospitals and go to see patients in their homes in order to save them. And this is the end of the interview, but it's giving a completely different approach of what we are doing today. Okay, I believe this interview is important because it's based in a lot of experience and things that are already working today. Now there is another interview that is very interesting, and this is from the mayor of a town, a very small town near Venice, that is also part of the region that is on emergency. And this is the mayor of a small town named Santa Lucia di Piave, as I say, near Venice. The mayor is also the doctor of this small place. He has 2,000 patients, and he made another interview with he saying that he uh, um, give to his patients this chloroquine, and that basically he's saying that he's the doctor of these 2,000 patients, that until now only one of his patients finished at the hospital, and not even necessary to go to in intensive care, that he's already at home, that for him is very important to take care of the patients at home and not wait until you are in a stage where you need to go to intensive care. It is many days that I'm saying the same. The difficulty relative to the breathing, pneumological difficulties, they have put in a second plane what is the situation. The virus, what's happened with the virus is that create a lot of an inflammatory answer from the immunitary system, and this will bring the patient to a pneumonia and especially to thromboembolism. He's saying that him using the same drugs that the other doctor is saying, anti-inflammatory and all that, was able to control the situation and to have very good results. Then at this point, I'm giving these two interviews about successful doctors and doctors with a lot of experience that you don't have in other countries, and even inside Italy, inside other towns. Then I really believe that these need to be studied, because this is a completely different approach. This is important also for many reasons, not only medical reasons, but also economic and social reasons. We cannot continue to be locked down like this, because it's extremely dangerous for the world, for the economy, and for everybody. And this is an approach that needs to be studied deeply. Basically, we need to be able to deal on the first stages with people at their homes, and governments need to be able to supply what is necessary in order to do that.